This is my mental health clinical placement on an inpatient ward. This is my first shift on the unit, and I'm really nervous. I'm not very confident in my skills, and I don't know what I'll say to the patients. What if I say the wrong thing? What if my patients don't like me?
I've been working on this unit for 9 years now. Working here is pretty draining on my personal life. I've learned a few methods of coping with some of the more difficult patients, but it's still a tough job.
I was admitted to this unit about a week ago and my friends made me get some help. The doctors here are guessing that I have schizophrenia. I'm not crazy and I really just want to go home. I miss my friends and it's so hard to be here with all the strict rules they have. I feel like everyone sees me differently and treats me like I'm totally unstable. I just sleep and read in my room all day long. I wasn't always like this, you know.
The patient is a 26-year-old female and presented to the emergency room with positive signs of schizophrenia. The patient had been experiencing an acute episode of auditory hallucinations with extreme paranoia and was started on a regimen of risperidone. The patient did not respond to treatment and was placed in seclusion because of disruptive behavior toward other patients. It is also noted the patient has a history of violence, but has calmed down enough to be examined. Vital signs are stable with a blood pressure of 116/75, pulse of 75, pulse ox of 95. This patient has a procedure in the morning. It's really important that you get her into the shower tonight.
I'll get the student nurse to do it. You heard the doctor. This is always a struggle. You won't be able to get a day pass without a shower. Do you want me to call security? Just PRN her. It'll take the edge off. Then she'll cooperate.
Hi, Mary. How are you doing today? We're going to need to get you into the shower. It's really important for your procedure tomorrow that your hair is clean.
I really hate showering here. We have to use shared washrooms, the water is cold, and I just feel so exposed. When I won't shower, they drug me and force me to go. They always tell me that I don't have a choice. I don't see what the big deal is. I just don't feel comfortable showering here. I mean, it's not like I have anyone to impress, you know?
Did you get her in the shower yet? Get going!
I hadn't gotten her to take a shower yet. My first day here, and they give me one of their toughest tasks. I heard that she has a purple V sticker on her chart. I wonder what she did. Did she stab someone? Is she safe to work with? I remember from relational practice class that as nurses, we should always approach people with the awareness that they could have experienced violence. Maybe I should just talk to her for a while. I sat down with Mary to talk about the situation. I found out that she was labeled as violent from resisting showers in the past. She's not a violent person. I know it was obvious that she didn't want to shower, and I figured maybe there was a reason why. People aren't usually difficult for no reason. It turns out that she had an abusive past and doesn't like being exposed and does not feel safe in this unfamiliar setting. I worked with her to come up with a plan that works best for her.
The student nurse sat down with me and we talked. It was the first time that anyone had actually asked me why I didn't want to take a shower. I think they always just assume that I'm trying to cause trouble or that it's a part of my illness. He helped me to understand that I am safe here and we made a plan that I'm comfortable with. I will still never be happy showering here, but I know that I have to do it.